Yeah, keep on my volume.
Got it?
Can you hear me?
I can, yeah.
Okay. Your office looks so neat. Oh my gosh.
You what?
Your office looks so tidy.
It's not really. You should see the floor, but look at my Glenhaven corner over there.
Oh, love it.
That's okay. Look, there's my entertainment center. I'm 3 feet from a 50-inch TV. It's kind of like God intended, I think.
Hey, do you do Zoom sessions on it? Do you use it
No,
as a monitor?
no, I don't have a camera for that for my desktop computer. But if I get a camera for it, I could, yeah. But I'm on my laptop. I'm on my laptop right now, so.
Gotcha.
So I haven't invested in a camera for that. Anyway, so.
I haven't done it. You know what? I've done it with trainings to where all well, you've been in here, the big TV. I'll set my iPad right up there in front of it to where I'm looking at the iPad, but I'm looking past it at the TV.
Yeah.
And have it go off the TV so that I'm not sitting there like that all day, but
yeah.
I would like
I
think my neck would like a monitor that sits up rather than me being bent over like this.
Yeah, I think so. Heather, how you doing?
I'm good. How are you guys?
We're good. Good.
Okay.
So we're recording all this, by the way. I'm just saying.
Okay, good deal. Because Amber, I've talked to her once this week, but I didn't talk to her about this. And I know everybody needs to be. Oh, good. Amy's getting on.
Amy's coming.
Okay. And just Lord give us wisdom, because this affects each of us individually, but it affects us as a team and affects our clients. And so Scott was like, well, you should probably wait till everybody can be on. And I was like, I can't do this anymore. I need to share this. What we're a team for us, and I need to share this with the team.
Right.
So Heather, do you have any road trips planned?
No, not really.
Gonna keep her home for a few days?
Yeah, I think so. She's got to go to the shop. We ran into I don't know what happened, but one of our slides, the front one, it won't go back out now.
Oh.
So, yeah, thankfully it's not the sleeping area, so it didn't affect us too bad. But yeah,
right.
So we've got to get her in the shop. But
what happens if it's out and won't go back in?
Well, there's a manual way to get it back in.
Oh, okay.
Yeah, you have to use like a crank thing to get it in, but yeah, no, it's good. We just, it was, I think it like happened on one of the, closer to the end of our last trip. It messed up for some reason. Brent's like, I probably hit a hole and got it off the track. So.
Oh, so probably no big deal.
Did you guys see the text from Amy? Or did she get?
It says Safari.
Hang on, I'll find the meeting ID. I don't know.
Okay. Yeah, she's asking.
She should be able to just click on the link, and I should admit her, but
it's 8. I'll send it to her. It's
okay.
827. It may be a rough start for me to say what I'm going to say as far as getting my thoughts together. Okay, so when I first started practicing in 2003 or 4, I joined with my position, asked me to join him. And that's how I knew to do what we do now, is he did it this way. Like it's just billed under his number. So then went in with Perspectives, and as well, Heather, you know this, when we were with Perspectives, you don't have your own Medicaid ID number, or you didn't back then. Yeah, Amy, you too. Well, so then what happened with Perspectives, we did the same agreement with Dr. Leader, and then y'all know we switched over to Dr. Martin. Okay, so it goes through her Social Security number. And back when Dr. Leader was doing it with us, he didn't want it under his social. And I contacted Medicaid, and they said, basically, no, we couldn't do that without being a group. And he didn't have a group, and so we didn't. Well, now Dr. Martin has a group. It's called River Valley Wellness, River Valley Medical Wellness, or River Valley Wellness. And she has 2 nurse practitioners that already operate under that. You know, the MAP program that she's doing, providing the medicine for drug treatment and stuff. Well, she doesn't want it under her individual. She wants it under the group. And so she had me contact Lumina, which, Amy, you know who that is. Are you using Lumina now? Okay.
Yeah,
Lumina
just
Lumina is a billing company, I guess. I don't know how to, but they do all of Dr. Martin's stuff. And so in kind of discussing, well, how do we move us over? It has come to our attention that some things have changed, and no matter what, we can't continue as we have been. It's not a thing anymore. So in talking with Maggie actually earlier, because she still takes her Medicaid through Counseling Associates, the reimbursement rate that for Counseling Associates, which is just an example of a group rate, is now the same as if we get each individually our Medicaid numbers and we bill individually. It went up, used to it was like $38, $39. Well, then a couple years ago, it went up to $92. Well, $92 is what Counseling Associates bills as well. So they get their cut, and then Maggie gets paid squat, basically, but just to say, okay, if we go under a group with Dr. Martin, I mean, she's not looking to make more money or anything, but even just the same 10%, that's going to put us at $82 versus $92 if we just bill. And either way, I talked to Medicaid on Thursday, and then I talked to him again on Friday, because I wanted to talk to somebody different and see if they gave me the same answer. And they gave me the same answer. To set up with her group right now, and I'm going to give you these details, which aren't important that you remember, but just to understand kind of a framework here. She is a Section 4 group affiliate, and she is linked with DOs, APNs, and MDs. She needs to add a 44 behavioral group -19 provider type to link to behavioral health, which is just Lumina can do that Lumina can get that set up. We must have one person with a Medicaid number, option A, or if no one does, we'll include banking on the first person that we enroll, the first therapist. But then basically they'll either Lumina or we'll do it individually. We'll each have to have our Medicaid numbers. So either way, we're going to have to get our Medicaid numbers. There are some advantages probably to being in the group with Dr. Martin, but there'd be some advantages too to us just being individual Medicaid providers. But what Maggie's text, the rates decreased a lot a couple years ago, and it hit Counseling Associates hard. So basically it hit all the agencies hard. So I don't know how we've still been getting the rates we've been getting. I don't know why it didn't go down back when it went down with the agencies, but somehow or another, I don't know. I'm not wanting to um, to really fight with them too much because I'm a little bit nervous that they could go back and try to recoup.
Mhm.
And that's what Dr. Martin's thinking. So we're like, um, I don't know. So thoughts so far, or have I made that part? Have I laid it out kind of to where y'all have questions or y'all understand?
Sarah had already told me a few days ago that I would need to get my own group number. So,
Okay. Is she going to do
yeah, I
that?
was kind of, yeah. Yeah,
Did
she's
she say
working
what
on
she
that
would
now.
charge?
Well, it'll be part of the billing, the Medicaid will, they do 3, they'll credential you for 3, the package that I have. And then after that, it's like $100 per insurance that they credential you for, I think.
Okay. Because I was thinking, I had heard we have there's a Facebook group called ILPs for Arkansas. It's basically people who get Medicaid providership just as individuals. And I have seen a range from anywhere from like 200 to 500 for somebody to credential us. And I would rather pay it. So if she'll do it for 100, that's fantastic. But I got
that
halfway through the
may be
process
part
a
of,
couple years ago and it was hard.
yeah, that may be part of the package that I have. So if you get a different package, it might be
Okay.
different price, but
Okay.
that's with them taking 10% and doing everything,
Okay.
all
Well,
billing,
I'm not
all
gonna-
research on.
Okay. I'm not going to use them for billing, but Dr. Martin said you can just pay that. We can just pay them. They will just, you can just pay them a fee and they will get you credentialed with whoever you want credentialed. So I will do that, but I'm not going to enter into a billing agreement with them. I just don't. And I'm really kind of glad that we didn't all switch over. We were going to all switch over to what's the S one, away
Simple
from CarePath.
practice, yeah.
Yes.
Yeah,
Because
I know.
I'm, it looks like that won't be a needed thing or a good thing.
How long is it going to take to get the credentialing done?
She said 30 to 45 business days.
Okay, so does that mean for that length of time, we're not going to be getting any income from that, like for all the clients we see during that time? Or does that mean?
Well, it could. She said it will backdate, like you can backdate it up to a year. But what I'm hoping to do is to do what we're doing right now with Dr. Martin until we each get our numbers.
Yeah, I mean, the RAs came in today and then there was actually a $5 increase on the hour-long, starting at the beginning of the year, it went from 161 to 166 for an hour-long session.
Right.
The current. And
Right.
the intake went up $6 from 191 to 197.
Right.
So it's too bad we can't still do that. That's all I'm saying. That's a
Oh
pretty
my.
big deal. And
Yes.
I mean,
yes.
if
And I'm
there
just
is a
sick
way-
about it.
If there is a way that we could, I mean, if I can input her, not her social, but her, business EIN instead, if there's a way to do that, then do we still have to get, if we bill like under her business, you know what I'm saying? Through CarePass, if I bill instead of her social, if I put her information other than her social in there, can we just transfer over instead of having to, because that would be a much easier way to do it, or do we still have to get our own Medicaid numbers? Or, you know what I'm saying? Because right now.
Well, from
it's
what
not-
they,
Go ahead.
that is a good question. Worded it the way you worded it. The way they've answered me is either way we can initially get in under the group without our own things, but we would eventually have to get them. She didn't say you have 30 days or 6 months. She just say you have to get them. But it backdates. It can backdate. You can ask it to be backdated a year, which it can't go, I mean, any length of time without getting paid.
If I switch it over now to her business, business tax ID or whatever instead of her social, then it can continue. We could still get paid in the meantime until we can get our Medicaid numbers. And I just didn't want to delay any payment for anybody, particularly Sherry, but I'm just saying,
Right.
if there's a way that we can continue to get paid, that I would be for that. So,
Well, as of right now, the one thing is we can't, part of me goes, we'll switch it over and run a claim and see what happens. But I don't think we better do that. Another part of me goes, that's probably not the best approach. Because they've said when her group, the way it's set up right now, she's set up as this one kind of provider type, a Section 4 group or something, and she needs an additional provider type added to that. And I think it's just a technicality, maybe a form she has to apply, send in or something.
okay.
But I know what and I want to know the answer to what you're saying is, okay, once that provider's SIP's done, can you just in our system switch it?
Yeah.
And it go in?
I mean,
Right.
all I would have to do is switch the numbers and whatever address, if I need to switch the address. I could do that with, Medicaid. I could do it with Empower. I could do it with Summit, and I could do it with Arkansas Total Care. I can do it with all of them. And then if that's how she's getting paid with the other places, it stands to reason that if I switched it, it would switch it for us as well, and it would bill it that way. But the only problem is they might see that and be like you're talking about, the recuperating, the stuff that previously we received. So
Right.
that's what I'm.
Amy, do you have any insight you can give us from conversation you've already had with Sarah?
No, I thought I was going to be the only one having to do this because of, my changes. But now I guess I see it's just moving to that. Though my understanding of why we're not getting paid for the passes is that might be that she's under there as an emergency room doctor and it's supposed to be coded differently or something.
Right.
Because
That's
I
what
think
I've
a
been
lot
told.
of us aren't getting paid for pass people right now
Right.
and haven't been
she
for a
said
while.
she knows how that happened. One of the, she contracts with so many different places and they have access and they switched it to that, which is kind of what we're saying on her group, that you have to have the right provider type down and you can have multiple, but the one is not down that allows for the behavioral health. So that's got to be added.
The only other thing Sarah
Um,
said is if anything ever, like if Dr. Martin ever went, a different direction or decided not to allow people to bill, if there's ever any change with Dr. Martin, that we would all have to, our billing would kind of stop until they got us credentialed. And then, so there would be a lapse there where you didn't get paid until they got your own group number.
Yeah.
So that would, she acted like that would be a big stop and big problem.
Yeah. And it would be because they would wait until you were credentialed to, provide payment, and you couldn't go back, of the people that you saw in the last 2 months or whatever, and you couldn't bill for those people. They would all be pro bono, basically.
Well, you actually can. You can go back a year, she said.
You can go back a year from the time you're credentialed? I thought you couldn't bill prior to being credentialed.
It's crazy, but she said we can go back a year. On our application, we can ask for it to be retroactive a year. Like if we started Monday we applied and we switched it. We just said, we're not going to bill any, and I don't think we should do this, but we said, we're not going to bill anything the way we've been doing it. We're just going to wait till our numbers come in. When our number came in, then we could bill, as long as we asked them to backdate it to January 1st, we could bill everything that for everybody that we had seen.
Okay.
So,
And do
so
they,
it's,
do they
we're not
assist
going to
you in
lose it, but,
credentialing?
huh?
Do they assist you in credentialing? Because it's not easy
No,
to
that's
get
where,
credentialed for Medicaid.
that's what I said. That's why I'm just going to pay Lumina to do it. I would just say pay the, because I got halfway through the process a couple years ago and
Mhm.
hit too many walls and just said, forget this.
Yeah,
And you did too, didn't you, for Sherry? Didn't
I,
you?
I tried. Yeah, and then they said I
Right.
needed two forms or something, and I tried to get clarification for exactly what they needed, and nobody could give me a straight answer, basically. And so it was like a DMX 653 form, and then there was another form or something like that. So,
Right.
and I mean, and also, from what I understand, they pay differently. Like, obviously, they pay differently for, you know, the level of education that the person's had. Um, it was different pay scales from what they told me. So I don't know, being a PhD, if you get more, or if you have a master's, or what, but I think it is different levels as well. So
Well,
it's not
the
going to be a straight.
PhD is, the
Go ahead.
PhD is only if your license is as a PhD, and the
Mhm.
only licensure that says a PhD is a psychologist. So like my Arkansas licensure is licensed as a professional counselor. So that's
Okay.
what they bill accordingly.
Gotcha. Okay.
Now, she did say though, for the Empower and the passes, that she told me I would not be able to go back and get reimbursed for those that haven't been paid.
Okay.
So I don't know.
So have they started your application?
Yeah, they just started it this week.
Okay.
There's an actual place on the Medicaid website, I believe you can start your application if you want to try it by yourself.
I've done it. Mm-mm.
Yeah, it gives you a track after. I mean, even if you stop if you stop in the like 3/4 of the way through, they give you a tracking number, and you can always go back and sorry. So if you need some assistance, if there's somebody that can help, and you get to a place where you're stuck, this is what I'm going to do. I'm going to try to do it again through that website. And I am going to just try to figure out exactly what I need before I even get to the point where it comes back with that what I don't recall exactly what it was. It was a form that I needed to fill out, but they come back after you fill it out, then they tell you you have to fill this form out. And so I'm going to just try to do the best I can to try to get that. And if I do succeed, I will try to let, everybody, give everybody a roadmap, so to speak, so that everybody can.
Okay.
I tried it a little while back and I got to a point where I needed a group number or something like that. So I just stopped. I didn't have a group number. So that's where I got stuck.
See,
Right.
that's what they're doing for me. They're getting a group number because they said I've been billing under even my commercials. I was supposed to have a group number for that, and I was billing under my social, and they don't recommend that.
Okay.
So they're taking care of all of that.
Okay. So when you're set up, will you be under Dr. Martin's group or your own group?
I have my own group.
Okay.
I think that's what they're saying. We'll all have our own group once you have your group ID.
Okay. So you've already, you're when this is set up, you won't be affiliated in the sense through Medicaid with Dr. Martin or River Valley Medical Wellness.
No, I was going to, but then they said long term it would be better if you get your own group number. And I've been praying about it for the last few days, but I just figured, they're going to get a percentage of what I bring in, and they know I'm getting paid a lot more, Dr. Martin. So if it was a good thing for them, then they would make sure it happened. But I think that long
Okay.
term, and maybe they could see that it's going to that there's a possibility we could get recouped, and that was going to be a problem. So maybe that's why.
Okay.
So
So
kind of
Dwayne
sounds
and
like,
Heather, what?
I was
Go
just gonna
ahead.
say, it kind of sounds like it's best if everybody gets their own number, from what I'm hearing. Then that
Uh-huh.
way, I mean, if you want to bill under Dr. Martin, if it's the same, it sounds like it's going to be 10% under Dr. Martin, whereas if you have your own number, you can basically get all the money yourself. And
Right.
I mean, that
Right.
sounds like the better option to me. I mean, especially
Right.
when we're getting a severe cut as it is. I mean,
Uh-huh.
if it went up $5 or whatever, the percentage is about 3% is my guess. It went up 3%. Does it go up 3% like for this level as well? Would there be like, instead of 92, is it going up to like 94, 95?
Yeah, probably.
You know what I
Would
mean?
be, so
So
Um,
Usually across the board.
it's probably
I'm
going
not
to
sure that it didn't already go up, because I know a couple years ago when I was filling out my paperwork, I thought it was 89. And now it's 92 something. But we can think positive and think, well, maybe it is fixing to go up for us too.
No, I'm sure it is. I mean, if it went up in July and now it's gone up again, it went up July about 3%. Now it's gone up another 3% in January. So if it was
Okay. Wow.
92,
Right.
I mean, it's possible it's up to 100, close to
Right.
100, 97, 98 by now. So
Right.
that's good. And 10%
Okay.
of that would be, roughly 88. So you want to go under Dr. Martin, probably be easier to do that. But it's $9 an hour. So
Right.
if you want to do that. So I'm going to probably try to get Sherry individual by
Okay.
herself. And then it doesn't really matter what system we all use. I mean, it's basically going to be whatever we want to do,
Right.
So I'm comfortable with CarePass. I don't have any problems with it at all. And so okay, so do I pay everybody what just came through today? The RAs, do I just pay everybody the same way?
Oh yeah. Yeah.
Okay.
And I've talked to Dr. Martin on Thursday and we texted on Friday. She's not, I mean, she has the same heart we have. She's wanting to be able to keep serving the CAC and all of our clients and stuff. So she is nervous, but she's not like, oh, I'm done. Y'all figure out. No, she's like, how can we do this? So I don't foresee her saying, okay, since they've said y'all can back bill, well, you can go back, then you're just going to have to write it out for yourself for the 45 days until you can back bill. I don't foresee her saying that, but as quickly as we can stop that, I would like to stop doing that for her sake. Because she is, I mean, that's why she gets 10%, because it's on her liability. I mean, she's holding, if they recoup, they're going to recoup from her. I mean, I would feel it's only right to pay our portion back, but oh my gosh, I can't.
That would be a lot.
I don't even want to think about that. Yeah. And I mean, at Perspectives, I can remember going through some audits and they were a pain, but I guess it was just different when it was, and I I guess we cared about the company, but we didn't. Not like, I mean, I care about Dr. Martin. I don't want to just go, well, that's your bad. Sorry.
Yeah, I
Um,
understand. Okay, well, I'll get started on this for Sherry, and we'll make the best of it, I guess, until I'll just go on the Medicaid website. Like I said, if you go on that Medicaid website, there's a place for those of you who don't know, that you can, it asks, become a Medicaid provider, and you just basically start a online thing. But
Right.
you all know that, I think, so.
yeah.
So, yeah.
Dwayne, didn't we have a conversation that we weren't sure about the LAC status?
Right. Yeah, we weren't sure. I mean, I can
Okay.
go.
Well, I saw, when I was looking for things, it's a memorandum from Division of Medicaid Services. Well, it's not letting me open it. And this was in March, and this was regarding telemedicine. As you know, Governor declared public health emergency, So patients receiving services from the following types of licensed providers enrolled with Medicaid do not have to go to originating site. Again, this is just something that was about telehealth, but it lists licensed psychologists, licensed LPCs, LACs, LAMFTs, LMFTs, or LAMFTs. So it lists the associates. I mean, to me, that just says, well, LACs can take Medicaid.
Yeah. I thought they could, but just, there's not a selection for LAC, it just says LPC. So, there's not a selection for that. So I just selected myself as an LPC and then went through, and it seemed to be going until I ran to the group number thing.
Okay. Well, the wall I ran into was when you got to some point and you had to fill out this separate form, like Greg's talking about. And you had to mail it in to a separate place. Well, it was like a month later, they mailed it back to me, and it hadn't even been opened. The envelope had been written on return to sender. And that's when I just gave up and said, okay, forget it. But
Yeah.
Okay.
I'll contact Lumen on Monday and tell them to start mine.
So
Yeah, I need to find out about that. Maybe we can talk about that when you get done, and because I'd rather someone else do it anyway.
Okay.
Well,
On the-
for Dwayne, I
ahead.
was going to say, oh, sorry.
Go ahead.
Ma'am. Sarah mentioned, I know you're not taking insurance, but she mentioned, I was asking her about Cigna and if they're good and if I should do them. And she said, well, they have some multi-plans that are really good. And we had an LAC. We have an LAC who just got paid like $215 for, I don't know if it was an intake or what it was, but I said, LAC? I didn't think that
And Cigna?
insurance paid. And she
Yeah,
said that they did. So
Well, that would be good to
I
know.
don't know.
That'd be good to know, because
Yeah.
I'd be all for part of that, especially for a while.
Yeah. And I
Right.
don't know how you chase it all down, but I know that I've heard people say in other states, even Blue Cross and some of them will pay an LAC. I mean, which would require you get licensed in another state if you're doing telemedicine with people in other states, if you go by that guideline. But anyway, that is interesting, Amy. Okay. Heather?
I was kind of expecting it. My billing lady, she's been trying to get me to get my own number for the past year. She wasn't really keen on the way we were doing it. Cause I was telling her that I was running everything through CarePaths, with all Medicaid, and then she was handling all my private stuff. And so she's been trying to get me to switch forever. And so she'll be the one to handle it for me. So it won't be a problem.
Cool.
Who's your billing person?
I use Cindy Debate. She's out of Clinton, but she handles a lot of different people across the state.
Okay.
Yeah,
Um,
her company, it's End of the Lawn Billing is what it's called, but yeah, she's done my billing for probably almost 2 years now.
okay. So you're just comfortable with, she gets a fee? Does she get a percentage?
Yeah, whatever I bring in monthly, she gets 5%.
Okay. And do you know, I guess is her getting, like you set up as a provider? Is that part of your package or does
It's
you just
part of
pay?
it, yeah. I don't pay anything else. She just will recoup whatever I bring in,
Okay.
the 5%.
Okay. So that gives us kind of two options, or three really. We can, like Greg's going down and do it ourselves. We can go through Lumina. We can go through end of the line billing. Okay. And
I'm
that's
looking-
interesting to me that y'all two are already comfortable using a billing provider. And like, I mean, Greg, you do, Sherry, so I totally see why you're going,
Yeah,
no,
Uh,
that's what I do, so I don't need somebody else to do it.
I was just letting you know that I'm on the website right now and it's saying, basically, there's something on there that hasn't been on there before. It's called, I mean, I hadn't seen it. It's called the top 4 provider enrollment issues when applying. And it gives you the main reasons why they get denied. So this is going to be a huge help.
Oh, well, that's nice. Yeah.
Yeah, so the top 4 are name mismatch. The name is incorrect. It has to match everywhere on the application, basically, is what it says. The second one is an incorrect W-9. So it's saying W-9 must be completed with the individual's information, name and social security number. For a group, it has to be with the tax ID. Missing attachments is the third one, and then an incorrect signature is the fourth one. And then at the bottom of it, it gives a number to call if you have any questions. It's the Arkansas Medicaid Provider Enrollment Office, and it gives you a number at the bottom of that link. So
Okay.
something, it says you can actually apply as either an individual or a group. So I don't know what would be better. I mean, I guess it doesn't really matter. Individual is going to be under social, group's going to be under tax ID, would be my guess. That would be the
Mhm.
two differences. And I don't know, this doesn't say you need a group number in order to apply.
That may
Anywhere.
not have been right. I may have ran into something else, but
No, I'm just saying
Yeah.
it's possible you need that if you're applying as a group. But if you're applying as an individual, you
Yeah.
probably don't need a group number.
but I'd probably do it under my business name. Just do it under my business name. Then that would be like a group, but with one person. So
Right, and I think
Right.
that's what I'm gonna do as well.
Yeah.
Because Sherry, with her name change, there's
Uh-huh.
been so many, I just don't want to run into that, so
Uh-huh.
we'll probably just book it under a Gentle Journey or something.
yeah, that's what
Okay.
I'll do.
Mhm.
Um, well, I feel better knowing that all of us are on doing this together, not just.
Yeah.
The enemy last night in the middle of the night was kind of having a heyday with my thoughts. So
Yeah, see, that's where I've been the
I-
last few days, and I'm like, oh, taking like half a pay cut. I don't think this could be a good thing. But that maybe it's all for our safety in the future, maybe that's all I could think is
Right.
maybe God's protecting us from something coming down on us in
Right.
the future that we can't foresee. I don't know.
It'll be all right.
uh,
It'll be okay.
and really what Maggie said this morning makes me feel like we probably, how do you say it, enjoyed the abundance longer than anybody else. Because if
Yeah, I
it
think
hit
so.
them a couple years ago, we just somehow it didn't hit us yet.
Mhm. So, okay. I'm probably gonna head on out, and I appreciate you guys doing this. Thank you. And like I said, if I figure something out, I will try to let y'all know and
Okay,
and try to make it as easy for everybody as possible.
Okay,
okay. And let's touch base quite a bit if possible, just to support each other through this. Like you said, Amy, you've been doing what I've been doing the past couple days and just going, oh my gosh, what, yeah.
But I appreciate you guys doing this, and thank you, and y'all have a good
Thank
rest of
you.
your day, okay?
Okay, get
Bye.
some rest.
Bye.
Bye.
I'm gonna-
Um, huh?
you pause the recording and we keep recording or what?
Just keep recording if you want to for a few minutes,
Yeah.
just in case, because Amber needs to watch. I really encourage Rhonda. I mean, she has some good insight into things, you know. I mean, and she is a part of the team. I know she's debated whether to go ahead and get her therapy license in Arkansas or
Right,
not, but it's like, oh, we're a team here. And yeah, we have to look out what is individually best for us, but what's best for us collectively too. And Amber, has anybody talked with Amber? Okay, I talked with her this week and she's just really, really, really struggling. So y'all keep her in your prayers. And I mean, I figure she'll just go whatever's easiest. If somebody can do mine, you know, I don't even know. I know she has a lot of Medicare clients. I don't know how many Medicaid she has. It's not easy for me to look in care paths and see that. So,
She's only doing telehealth right now, right?
yeah.
Heather, are you still just doing telehealth?
I am.
How is that?
I mean, it's going good. I'm fully booked. I mean, I haven't had any issues.
Right.
I've got like one person who keeps asking about going back to the office, and I just keep telling them, like, if you need me to refer you to somebody, I will. But right now I'm taking care of my mom too, and I just can't risk it. And they're like, no, we're gonna wait. So they're holding out for me.
good.
But yeah, I mean,
Okay.
I'm staying really busy and I get new people every day. So, I mean, I haven't seen any decline.
Helping Hands, Stephanie Metcalf at Helping Hands is really referring a lot to us. So if y'all need, and I like to refer, what happened, I think, is I started referring to her for labs. She's real good about, we can send somebody down and she knows to check their D, check their B12, look at allergy stuff. And well, she's referring a lot to us too. And in fact, I've got like 3 calls from, I guess it's one of her nurses this week going, I'm just following up to see if y'all got these people scheduled. Like, so yeah. Heather, I'm trying to go in one day a week and just do my telehealth from the clinic.
Mhm,
And I don't know, because I like felt detached from
mhm.
everybody. And I'm still like, Amy, I think I've only run into you like twice, but it still helps me to feel like, okay, I'm in the building. And I've had clients go, well, if you're there, can I come there? I'm like, no. Let's just keep it this way. So that, especially I put it off on Amy and Dwayne and Sherry. I'm going, we need to give them their space for their clients, probably, you know,
Yeah.
and then, but still, at least it's something to be able to be around each other.
Yeah. Yeah, I started doing that when my house was under renovation and I couldn't take it anymore. So I started going into the office in April, I guess, just so I could, it just gave me that structure and a clean office to sit in while I did the session. So I didn't miss a lot of time there, I guess. But it was kind of lonely being the only one over there for a while.
Now, do y'all run into Maggie some? Because I have not, which I guess she's there on Fridays, but I haven't
Yeah.
run into her.
I see her when she
Little
comes
bit.
in usually.
Okay.
She's there Mondays too, or another day, not just Fridays.
Okay.
She's there
Okay.
another day. I mean, maybe Mondays or two. So I see her early in the morning. You know, I don't see her so much on Fridays, but I see her when she comes in on Monday or Tuesday, whatever day she comes in. She comes in another day for part
Okay. Is she, I mean, she had said she was transitioning over full time, but I think Counseling Associates really tries to keep her part-time with them or something.
Yeah, she's with them
They've given
quite
her
a
a
bit.
different date.
Yeah, she's with them the rest of the time
Okay,
over there because she came back one day last week when no one was there and I was just there by myself and she said, I guess gotta pick up something or go back to counseling associate. So yeah, she had left something there that she needed.
okay.
Anyway, so
Last time I talked to her, she said she has like 26 clients already. So she said she
Wow.
didn't expect to fill up that fast. But
Yeah.
so she's pretty full. And so it sounds like she has two full-time jobs.
Oh my goodness.
Counseling is what it sounds like.
I know what it was like during the summer when I saw 38 or 39 for a few weeks in a row and I was like, I can't do that. So I can't
No.
imagine she's probably seeing over 40.
I don't know, but
don't know.
that's too much for me.
Mhm. Me too.
My
I
brain
feel
doesn't-
myself checking out. I'm like, I am not being a good therapist right now because I do not care.
Yes, yes.
Yeah, I definitely have a limit. That's very true.
Yeah.
Well, I hate to run,
Well, it was
guys.
good
I've
while it
got to
lasted.
go take out my doggies. They're
Yeah.
coming up trying to tell me they need to go outside, so I'm gonna go take
Okay.
care of them. But
Okay,
thank you
well,
guys.
Good to
If
see
thoughts
you.
come up or anything, I really, I'm going to go with, I guess, with probably Lumina just because I've already had conversations with them. And since I'm not going to, if I was going to go with their billing, I would probably talk with end of the line too and just say, okay, why is 1.5 and 1.10? But, just like we usually do, let's stay on board with each other and kind of help each other through this process.
Sounds good.
Okay.
Bye,
Bye, y'all.
Heather.
All right, bye, guys.
Bye.
Dwayne, how do you feel about this?
Well, it's just different. I mean, it's just a change. And so I got to, because
Right.
I'm really
Hold
not,
on 1 second.
okay. I don't know. I mean, if we can get together and I talk to those Lumina people and get my application started or whatever, just about at least get it registered through them and then figure out the billing part of it later. After I get my.
They have smaller packages too, so you don't have to do the 10%, I don't think. I think you can do other things where they do less and you pay less.
Yeah, that's what I want to talk to them and see.
I've just lost so much money. I can't do this on my own.
Right, I'm with you.
And here's something that she said to me too. I said, well, because like if I'm growing and wanting to bring in like play therapist, more play therapists and stuff like that. She said, if you get to that point where you want to do something like that in the future, that's why it would be better to do your own group. But
Right.
also, I said, well, would you have trouble bringing people in for Medicaid when they're getting paid less? And she said, which now I guess they wouldn't be getting paid less because we're all going to be getting paid that price. But she said, you really don't want to build your practice. You really don't want to build a practice on Medicaid. And I was like, really? And she said, yeah. And I mean, I've heard that on podcasts and stuff before, but I've never really understood it because I've had so much trouble getting paid with the insurance. But she said, oh yeah, you get paid better with insurance. Well, I guess that's what she means. Like normally people do get paid better because if they're getting paid $92, insurance pays more than that.
Yeah.
We just haven't experienced that.
Right. And I've been the same way. Because I started out under one of these agreements with a physician, I've always gotten paid at that higher rate, except for when I was with Perspectives. But yeah, now I see, okay, what that means okay, they don't pay as low as Cigna. I'm surprised that she said that Cigna pays.
Yeah, I know. Well, she said there are some multi-plans, so I don't know what that means, but I just said, look, if there are certain groups that y'all know are notoriously bad, and then I don't want you to even go through the work of doing that. But
Right.
Right, yeah.
I, on my own, had written a letter to United Healthcare saying, take me off of your contract. I don't want any part of you anymore. I've had so many problems. But she said there, I think it was just, I was trying to do everything. Like, I don't know if y'all have the same issue, but I am constantly in contact with these parents, and they're canceling or they're switching or somebody's quarantined and so it's a full-time job just to do the reception part. Like at some point I'm going to have to go ahead and bite the bullet and have a receptionist. I mean, it's been
Right.
that time consuming.
Right. Well, when we first, back in 2015, when we discussed doing what we do, and actually that discussion was me, Rosemary, Melinda Taylor, and Gary Scarborough. Our plan was, because I said, I can't operate without a receptionist. I was just adamant. Somebody's got to be there to do it. Well, then Gary bought the place out on Aspen, and Melinda was like, whoa, that happened too fast. I wasn't sure that I would move my entire practice. Plus, her mother-in-law came in and started doing her reception
Yeah.
and billing. So, and then we just kind of got away from it. But that was our plan, is if 4 or 5 of us split a receptionist, we could afford that, and
Yeah.
take care of the reception as well. So, I mean, that is still a thought I would be on board with. And then let's get through this hurdle, I think, of getting reestablished with Medicaid and that kind of thing. But yeah, I mean, I don't know if that's if you would consider doing that. One receptionist that works for 4 or 5 of us or something, when we split her or his salary, I guess what it would be.
Yeah. I'm kind of I'm like you. I kind of want to get past some of this stuff and see how it goes and everything. And then maybe
Mhm.
consider moving to something like that. Cause it's just like when I could be doing notes, cause I've tried to like build in 2 hours where I can do notes, and I'm answering emails and phone calls and it's, I mean, I feel like I'm complaining over a bad thing. It's not a bad thing. It's just, it's very time consuming. And the parents of these little kids, it's too, also that they're so they can be kind of high maintenance.
Right.
I need to talk to you. Well, I don't, yeah, Dwayne gets that a lot too. So
Yeah, well,
that's probably one of the downfalls of being kids.
Yeah, I tried to find their time. I said, you can come see me before session, or you can send me a text and I'll step out and talk to you. But otherwise I'm not available. That's what I have to that's just what you have to do.
Mhm.
You know, if somebody has an emergency, which I've had with this one kid, but then Amy, you told me about billing an emergency thing. That's cool. I billed that twice. I billed that twice. I'm fixing to bill it again for the second time, because I spent 2 hours with them in the morning and they came in and we did extra 20-30 minute session with the parents. And I'm not gonna bill it as a family session because that's even less. But if you bill an emergency session, you get paid more.
Right.
So that was good to know. I mean, that will probably change, but you should still be able to bill it, even though it won't be as much as it is now, but it'll still be more than it was. And I really think that I'm going to start collecting debit cards information. I know it's a security issue,
Rosemary does that.
but and then if you don't cancel when I send out my reminder, if you don't cancel, if you call me the next day and say, oh, well, I forgot, well, I'm gonna charge you $50.
Right.
I was just going to start it. I'm gonna hit that debit card for $50, and I mean, that's not a whole session fee, but it's something.
Right.
Because I probably can't schedule that hour.
Yeah.
Because I don't have a secretary. If I had a secretary and she could schedule that hour within 30 minutes, that's fine. But if you don't, because I send out reminders. If you cancel on a reminder, that's fine. I
right,
have no problem with that. That's why I send them out,
right.
you know, but
Rosemary has done that for, I guess, since we've been in, since 2015. She just always does that, gets a credit card or gets a debit card.
yeah.
Yeah.
And I have it on in my intake stuff, but I've been enforcing that. So I need
Right.
to start enforcing that. And that's the part.
I have
That's
too.
the part where that's the
Yeah.
part that I don't like to do, right? Because I want to be a counselor and I want that relationship to be there, and that kind of gets in the way.
Right,
So,
Mhm.
but with kids and parents, it won't get in the way.
right,
They won't get in the way.
I'm gonna ask them about that too, as part of the billing. If I code something as a no-show, will they automatically
Yeah.
do that for me too?
Yeah. See, so if you had,
But go ahead.
I said, if you had a receptionist, that person could do that, and it would be off your shoulders.
Right.
You'd be like, I don't
Right.
handle that. Like this company handles that for me. You can take it up with them.
and we have that receptionist area up front that just sits there.
Right.
Yeah.
Anyway,
Well, in advanced MD, I've heard that that's, they say, well, it can be a little complicated, but from working at different facilities, you've had to learn different things. And so I was like, one thing that I can get as part of my package, or I don't know if it's part of my package, it might be separate, but I can get all my intake forms in the system to where they can go on and they can complete that, and it's secure, and they can send it back to me, and then they can check in, which I don't know if that's going to be an issue. But then also, what was the other? It'll do reminders for me, because I sit here in my house and do the reminders, so that takes some time. And then it also opens you up to people starting to text you too when they know you're sending the reminder. I don't know if you have that, Dwayne, but and then there
yeah.
was something else. What? Oh, I can take their debit card and it will automatically put it in. So I don't have, on CarePass, you can take a copay, but then you have to go in and say, I took this copay and so much it was, and I took it on a debit card. You have to fill that in. This will automatically put it in on their account that the copay's been paid.
Right.
But that costs, I think that's a little extra, but
yeah.
But these things that are worth, I mean, your time is worth that. If that frees up hours and a week and less stress on you. Mm-hmm.
Right. Yeah. If I could just focus on counseling and focus on what I need to do, and I could take this extra time and do research for my clients, because I don't know about this, and what I really want to do, what I really want to get into, and I can spend time working on that instead of, sending reminders and doing things. That's why I was talking about that 10%. Would be like, that's not that big a deal when you consider how much more effective you can be with your clients.
Well, Amy, I'm going to let you be the guinea pig, and in a sense, and see how it goes, and honestly get set up with Medicaid and get that headache out of the way. But y'all know I've never collected copays, so probably even just using them and they would collect the copays would help pay for their service. Plus, not to mention the several that I just don't get paid for because I don't follow up. I had two one lady that I've seen, and all year she had Blue Cross, and then she got a different job, and she said, just for December, I'll have Cigna, and then I'll switch to Aetna in the spring. Well, I went in and something happened with my Cigna in the system, and my information isn't in there anymore. So I was like, I'll just eat it. I'll eat those December charges because I'm not going through the trouble of setting it up. To whereas if I was using a billing service,
Right.
And the attestation stuff that they send you, CAQH, whatever, they'll do all of that.
Okay.
I know that's simple, but it just annoys me that they send that so often. It feels very often. It's probably not as often as I think it is, but.
Yeah, you're really making the case, because I lost my Aetna providership all of last year because I didn't attest. They had specifically, I had to attest with Aetna and I didn't. And so then I was getting claims denied. Well, I asked Mason to check into it, and he did. And he goes, you just didn't attest. And so they kicked you off. So it took them all year. It took from like March until I just got it back. So yeah, you're right. There is some big perks to using a service.
Well, and then she said, like, I'm also wondering 5% versus 10%, but I'm gonna go with it. But she also said when I do my notes, there's automatically something connected to it so they can see like, hey, you haven't done this, so that we can let you know you haven't done this, you need to do this before we can bill it. And she said, and once you get that revenue flow going, you know, you'll get paid every 2 weeks by Blue Cross. You get paid every 2 weeks, I guess, and better, you know, so you'll have a constant flow coming in. It's not like you've got to wait till everybody's paid under one thing or anything like that. So, I don't know, I'm just, it will save me a lot of stress because I'm knowing that I'm not getting paid and it's stressing me out.
Oh, yeah,
But I
absolutely.
don't know what to do about it.
I'm with you. I'm right there. Yeah.
So that's creating even more stress. So I guess it's been so bad that even when I called my husband and said, they're saying that I will get this $92 rate instead of the $180. And he's like, trust your billing company, babe, just go with it. It's going to be better. And I was like, what? But he just sees how much stress that I've had with this billing stuff. And so
Right.
we'll try.
Oh, that's wonderful. What are you thinking you'll do, Dwayne?
Well, I need to check it out and see. I need to see what's going on, see what my options are. I talked
Okay.
to this company that Amy's talking about, and certainly an individual is going to be cheaper than a company, right? Like Heather has an individual that does it. That's what
Yeah.
she does.
Right.
She's
Right.
an individual, and so she's going to charge less because she probably can't provide some of the perks that, I mean, she does her billing, and she does her secretarial stuff. You know, what are you not getting with her that you get with the company? So that's the
Right.
question. You're probably not getting the computerized platform with your notes and all that kind of stuff. I don't know that you're getting all that.
Right.
You know, you're not getting that, certainly.
Yeah, I think Heather has a certain thing she can use.
She uses something else for her notes, probably. I mean, I don't know, but
I think she uses Simple Practice.
Yeah.
yeah, Simple Practice. So that's separate. So you got that fee. How much is that
Right.
fee? So
Right.
then does that add up to 10%, or is that close to 10%? You know, what's the fee for Simple Practice? I'm sure it's not cheap, but even though it's a really good program, Simple Practice, from what I've heard, is really good.
Right.
Right. And from what Amy, you're talking about, this one company, what's the name of it?
Lumina, they use Advanced
Lumina.
MD.
So
The bill.
yeah, so Lumina, they're charging 10%, but they're providing
Well,
all
they said,
this other stuff, right?
well, and I have to do the advanced MD separate. I do
Oh,
have to
okay.
do that separate.
Okay.
All
But
right.
I was willing to do that because it's what they typically use to do billing. So I figure they're very familiar with it. They've worked out the kinks with it. They
Right.
were telling me that sometimes Simple Practice has some stuff that makes it difficult for the billing part. So I just decided to go ahead and go with it.
Yeah, I like to meet
They
with
also
you and
said
talk
they
about
could
that.
they said they could get care stuff off.
That's huge.
Yeah, that's a big deal.
So
Yeah.
yeah.
Yeah, just let me know. Maybe we can meet one day next week and talk about it, and you get the specifics, and I can contact them and get the ball rolling on that, and if they'll do my Medicaid thing, that'd be cool.
Okay. Amy, are you
Yeah.
talking to Sarah? Is that who you're talking to?
Yeah.
Okay. I'll
Uh-huh.
send it to you, Dwayne, because she's familiar with us too, because they do all the Dr. Martin stuff and she
Yeah.
knows the situation we're in.
Good.
Um,
Yeah, let
so-
me know.
Um, okay.
Okay, are we good?
I think we're good.
Do you feel more at peace now?
Oh my gosh. Well, enormously, just what it's because we're all carrying this burden together, transitioning through this. Amber is the only one, because I've kind of talked to Maggie, but she said she's not, it's not the same for her because I don't know where she's at, if she's just going to totally come. I thought the plan was she was totally at some point leaving Council Associates.
Yeah.
Right? Have y'all heard her say that?
I haven't talked to her at all in that regard.
Okay. When she came in with us, that was her plan.
Yeah.
Which she was hoping to be full-time with us by September, and then it was November, and
Right.
so I'm sure they're just holding on to her.
Yeah, probably so.
And then, okay. How can I get Amber the link so she can watch this?
Well, I've had it recorded on my computer, so I'll figure that out.
Okay.
It's recorded locally, so it's on my computer, and I will figure out how to post that. Probably put it on my Google Drive and then share it.
Okay.
Okay.
Okay. Just try to share it to the group message that we have this morning. That's just us.
Yeah.
Not trying to exclude Dr. Martin, but I kind of wanted to know where we all are together before I go back to her.
Yeah. Yeah. We'll figure it
If
out.
that makes sense. And
I'll-
you said she ran into you at the CAC. Did she
Yes.
talk to you about the grant money?
Yes, she
Okay.
did. That's
She-
all in the sort of in the
Okay.
up here in the ethereal plane. It's not. I don't know how solid that is yet, but yeah, that's great.
Well, she makes stuff happen.
I know she does. Yeah.
Amy,
I'm
she
not-
started that MAC clinic.
Yeah.
She
Mhm.
started that MAC clinic. Well, she's getting grant money, and
Right.
she's wanting, I guess, Dwayne, she's wanting you to do some of the therapy.
Right. Yeah,
With-
that's great. I'll
okay.
do it. Yeah, that's wonderful.
Okay.
Yeah, cool. I'm all over that because you talk about how well it reimbursed, and that's cool. I'll do that. Yeah.
Right.
Yeah.
Amy, do you know, and I'm excited for her and for the options that we have. They bought Lake Point. Where that's at. It was the tech thing. It's out by the nuclear plant, and they had weddings there a lot, and they had lodge, and you could stay over. Well, now they've turned that into like mothers with addiction can stay there, and they get treatment.
That's cool.
So, yeah, I wanted to say maybe
She told me a
said
little
mothers
bit
with
about
kids.
it.
Okay.
Yeah, she did. She did say that.
Yeah. I don't know. I mean, I'm sure it's going to change a little bit, but I want to keep teaming with her. I love her, just her knowledge and her drive. And
Yeah.
I just want to be sure that we
Yeah.
don't lose that.
No, I don't want to lose that at all. Yeah.
Yeah.
That's good. That's a good partnership.
Okay. Well, y'all have a good day, and thank you.
Thanks a lot.
Bye.
Okay.
Bye-bye.
You too.